Hello, and welcome back to another episode of Straight Up with Steph. Today, we are talking about bullying, specifically professional bullying within dentistry. I don't know if you've ever had the history of being bullied. Looking back on my career, I don't know if I've been bullied per se. I know that people have definitely tried to intimidate me, but I experienced bullying more when I became really active on social media, unfortunately. So I know what it feels like, even if I didn't experience it in the dental practice. But I hear about this a lot. Dentists being bullied, hygienists, assistants, office managers, it happens to everyone. So I just wanted to bring some awareness to that and talk about how to recognize it, but also how to handle that. I decided to bring on Alan. He is a dentist, but now he has a coaching business. And he was really excited to talk about this because not a lot of people are talking about it. He gives some great insight on why bullying persists in dentistry, kind of the history behind it, how to recognize it when you're not quite sure if you're being bullied, but you know something negative is going on, and also how to really handle it. And I think bullying happens because we're just not equipped with the tools to handle confrontation in a healthy way. There's a lot of reactive type responses where people are just angry and yelling at each other and throwing things and pointing fingers and storming out of the office. I understand it because I understand anger, but it's not productive and it really doesn't lead to anything good. Alan has such great wisdom and a lot of pearls on how to handle those situations. We even did a little bit of role play where I described some situations that I've either heard about or I've experienced myself between dentists and hygienists and assistants and office managers. And the way he frames how to handle these conversations, you just have to listen to it. It's so smart and it's a lot better than I ever handled these things in the past. So if you've ever experienced bullying or intimidation and don't really know how to handle it, this episode is definitely for you. And I hope you enjoy it. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Alan. Thanks for joining today. So good to see you.
Stephanie, it's great to be with you, and thank you for having me. Let's have a little fun here. Let's get this party started.
Well, yes, and I know that you will make it fun, although this topic might not be so fun depending on a person's experience, right? So
Yes,
I
yes.
really I wanted to do an episode on professional bullying because this is something I hear about a lot. So can you I feel like in some cases bullying can be really obvious, but then in some cases it can be kind of not so obvious. So do you have some examples of how that would show up in a dental setting?
It's funny you asked that, and we talked about this a couple of weeks ago, but in my last two group coaching sessions, that subject came up,
Hmm.
and it seems to be prevalent with women on the
Like getting bullied?
prevalent, but not exclusive. Yes, on the
Okay.
receiving.
Okay.
And I'll give you an example of a Y chromosome who got hammered.
Okay.
So, but, you know, I think it goes all the way back to our dental education. And I'm not going to point fingers, but I am going to create an awareness here. The system of dental education really beats us. It hurts us. Because if your work is not perfect, it's garbage. And when your work is garbage, you're garbage.
Yeah.
And that is just a subliminal message that every one of us receives. And I think when we come out into the world, knowing that back here and knowing full well that we will never attain that, that's a problem because we begin to see ourselves as something less
Hmm.
and something that deserves to be beaten on and pounded on. And the other trend that's out there, Stephanie, is that the dirtiest word in the English language. Did I tell you what the dirtiest word in the English language is?
I think I'd remember that.
I spent most of my adult life in New Jersey, so be careful here.
Okay.
The dirtiest word in the English language is provider.
Okay.
That is a word that's being used by forces that are bigger than we are, by corporate entities, for-profit corporate entities, who use us as a pawn in a game, that we are not providers. There are insurance providers, there are cable service providers, there are internet service providers. The stadium in Philadelphia has the official billboard announcement provider. Are we them? Dental dentists, dental hygienists, are we really in that category? Or did we go to school for X number of years post-college with X amount of debt, with X amount of blood, sweat, tears, heart, and soul, doing things that 93% of the world cannot do and has no clue about? We need to start seeing ourselves better so that we can, if you want to talk about it in terms of bullying, okay, so that we can stand up. And if we want to talk about it in terms of how patients view us and how, if we're working for corporate dentistry, how the bigwigs view us, we got to first start changing the way we see ourselves. We're healers. We're doctors. We are practitioners of a profession. When we do that, that is the first step in conquering this beast. I've heard stories of patients looking at attractive women and saying, when's the doctor coming? At young women saying, are you old enough to be a dentist? You don't look old enough to be a dentist.
Mm-hmm.
And the other great one I hear is, what country are you from? I don't want a foreign dentist here. I hear stories of office managers, and I'm going to embellish this a little bit just to make the point stronger and put a smile on people's faces. But I've heard stories of office managers giving a dentist 30 minutes to do an endo on the upper second molar on a 300-pound gagger.
Oh, good Lord.
Yeah.
Yeah.
So that's a little embellished, but the
But I
point,
get your point. Yeah.
we are being worked to the bone. We are treated like factory workers, providers, and not as professionals. And our licenses are put on the line sometimes by the judgment of somebody else who doesn't have a dental license. And all of this leads to tension,
Mm-hmm.
a tension. And that, when we get into this really stressful mode, we go into this aggression mode. Everybody's under so much pressure, Stephanie.
So is this an example of just like shit rolls downhill? Like we've got it up at the top, the employer kind of pressuring maybe the dentist, for example, bullying the dentist, and then the dentist maybe starts bullying the assistant or the hygienist, and it just kind of perpetuates this cycle?
No, I think if you're going to use that word, you've given me license too. The
Oh,
shit,
yeah.
the excrementia impacts the ventilator. The shit hits the fan.
Yeah.
Because personal directions. I have heard stories of dental assistants bullying dentists.
Yeah. Yep. And
That,
hygienist bullying dentists too. I've
yeah,
seen that.
panel on the office manager that, the dentist didn't want to do a crown. They did a filling instead. Or the dentist didn't let me do an SRP. They said it's just a prophy. Yeah, it's conflict that's mishandled. And in terms of female and in terms of nationality, it's fear. I have 102 Alanisms as of this date. Alanism number 32 is one of my favorites. Anger is fear in disguise.
Yeah.
And when people get stressed out, they go into that fight or flight, and they will thrash at anything in their way, including a woman, including a man who's bullyable, including somebody who's more educated, including somebody who looks different and talks different.
So
Yeah.
why do you think that is so prevalent in dentistry? Is it because of what you just said, like the pressures that everyone is under and just kind of this historical history of like women? It seems like historically men in dentistry have been in the position of power.
Yeah.
Women are, I hate to say this, but below them in terms of the office hierarchy. And then that bullying is just almost like systemic in our profession.
Yeah. Well, it goes back to the old days. I started dental school in 1977, graduated in 81. No old man jokes out of you, listeners.
No, I'm not even, no, I'm not
I
going
don't
to say
want
anything.
to. I got guns, baby. By the way, some of my best trainers were women.
Yeah. Oh, I bet. They're
Yeah.
beasts in the gym. Yeah.
Yep. Some of my best advisors professionally are to this day women. But,
Yeah.
back in the day, during my dentist's heyday, it was the doctor and the girls.
Yes.
That was the phraseology that was used. Even the hygienists, who are arguably extremely well trained, in fact, not arguably, extremely well trained,
Yeah.
they're still called the girls because dentistry has been a predominantly male profession until now.
Yeah.
And I believe, Stephanie, the culture is changing very quickly.
Oh, 100%.
Right.
Yeah.
Half of classes are women.
Yep.
A majority of my coaching clients are women, and they're great people. But I think what we're seeing also is a cultural shift. And people haven't caught up with that. People haven't begun to realize that you are every bit as qualified, powerful, compassionate, and capable as I am.
Yeah.
And I think it's going to take a lot of time for our culture, probably about the next 5 to 10 years, is going to see that change. Because
Yeah.
most dentists, and I bet you most physicians, are going to be women also.
Yeah. No, I think so too. But also, with change comes conflict, and just the
Yeah,
fact that things are changing, maybe people aren't comfortable with that, and then maybe they'll start lashing out.
sure. And we have to deal with that.
Yeah. So
We,
how do you recommend someone, if they know that they're being bullied, how do you recommend that they deal with that when they're scared of maybe losing their job, or they don't want to have retaliation from someone?
it happened to a man who was very close to me. And I'll disclose it to you privately. I don't want to go total public with it yet. But I know a man in a government setting who was bullied, harangued, and beaten on by his two female supervisors.
Hmm.
And he was in a dream job and he had to resign and file a lawsuit.
Oh, wow.
Yeah. But in a dental situation, I think we have to understand a couple of things. Number one, we have to be very, very sure that this is hostility and not ignorance. If it's
Okay.
ignorant, it enlighten. If it's hostility, we have to stand our ground. Remember, assertion, there's a principle of assertion, Steph. That is, I won't hurt you, but I will not let you hurt me. So what we want to avoid is getting into an escalating war of healers.
Okay.
Instead, say, look, doc, or look, Polly, I don't understand why you're doing this. Let's sit down and talk it through. Let's figure it out because we both stand to lose. I will not tolerate this. I don't want to hurt you. I want to come to an agreement. Why do I suggest that? Why do I suggest not fighting fire with fire, not fighting snark with snark? Because what good will that do?
Yeah. It just escalates.
Yeah, once you do that, you're not going back.
Yeah.
So if we're going to be professionals, if we in the dental profession, not the dental industry, that's another dirty word, but if we are professionals here, if we are professional practitioners and healers, then we have an opportunity to see if we can fix it. And maybe we can, and maybe we can't. But I think if we are going to be above it, because we are better than this, Stephanie, we are better than the ignorant people who throw barbs at us. So short of an existential threat, or short of a mental health assault, full-blown assault, we have an opportunity to educate and enlighten and maybe turn a conflict into a collaboration. Are you afraid of something, Mr. Bully? Are you scared? There's more to these words than this, of doc or assistant. What's going on? Tell me what's troubling you. Let's see if we can figure this out together. Well, I don't believe that broad should be in the dental business. We have a disagreement here.
Hmm.
And if you want to talk it through, that's great, but I'm not going to tolerate that. What I can tolerate is some curiosity. And I would love to know why you feel that way. And if you do that, when you do that, number one, you're behaving as a professional. Number two, if it doesn't work, you can always go to the next step. You could always go, like that gentleman who's close to me, and file a lawsuit or file a complaint with the state board or whatever. But I think we owe it to our humanity to try and fix it first. Because you can't go back. Once you start, in this individual's case, a lawsuit, you ain't going back.
Well, I really like what you said just about being curious. I think that that's a really good mentality for us to have, just period, in life. And
Agree?
don't assume that the person is deliberately trying to help you or hurt you, excuse me. Like we never
Yeah.
know what's going on. But I think when you approach someone and ask them to have a conversation with you, their response to that, I think, shows you a lot.
Yeah.
If they're willing to do it, but then if they just blow you off or keep blowing off your meeting, you kind of know what you need to do from that, right? Because they're not prioritizing you at that point.
Yeah, exactly. Exactly. But you can, you can shock a person into kindness. I had a client ask me just before we hopped on, I have a wonderful, wonderful woman dentist, just beautiful on the outside, beautiful on the inside, with a heart of gold. And she's new to a practice, and she's 29 years old. She looks half that.
Hmm.
And of course, the question is, when is the doctor going to be here?
God, that must be so tiring for her.
Tiring, but actually, it is a very, very solid opportunity for my doctor because what she can say is, tell me more, because I am Dr. Smith.
Hmm.
I'm curious why you'd ask that. Let me help you. Well, you look too young to be a dentist. Wow, Mr. Smith, I really appreciate that. You know what? I am very grateful for my youthful appearance. And I'm getting old, Mr. Smith. I'm 29. But if you think I look half that, man, I'm going to call my parents tonight because I'm blessed with beautiful genetics from them. And I'm going to thank them and tell them that I had a patient think that I'm 19 and I'm so grateful. And if you want to really have fun with it, I counseled her. I said, you know what, Mr. Smith, I am going to keep working on being fit and being young looking because when I get to be your age, I want people to keep asking me that.
It's so disarming, you
Isn't that?
know?
But it's
Yeah.
not negative.
No.
It's positive. So why can't we rise above the idiocy? Why can't we rise above the ignorance? You can't always do it. There's a time to fight. There's a time to fight. There's a time to fight bigotry, racism, and even that can be dealt with on an individual basis, but on a mass basis, sometimes you have to raise your fist. But on an individual basis, like a dental setting, or even a corporate setting where you're working with other colleagues and coworkers, you've got tremendous opportunity to build bridges.
Mm.
And if we can prevent our natural instinct, our amygdala, our fight, or freeze brain that kicks in when there's an existential threat, God forbid if somebody holds a gun to your head. I mean, you're not going to negotiate, help me understand,
Yeah.
sir. Holding a gun to my head. We're not doing that. But if we have something in a professional setting and we can rise above it, nothing, it can't get any worse. It could only get better or be unaffected. No, you
So
can't.
I just want to ask you just
So,
how talking about like rising above things and being curious, I've personally had some things that have happened over the years, and then I hear from my followers too. Like there's kind of these similar messages that I get. So I kind of want to just give you some scenarios and you can give me a good way to handle that. Does
like
that
I
sound
said,
okay?
let's get this party started. Let's see if we could turn confrontation into collaboration. No 100% money back guarantee, but let's see what we can do.
Okay. So, first one is let's say I'm a hygienist, which I am, but I'm a hygienist and the dentist constantly puts me down in front of patients or dismisses my recommendations in front of patients.
Hmm. Hey, Doc, can I talk to you at the end of the day? You be the doc and I be you. Can
Oh,
I?
oh, I'm the doctor. Sure. I only have about 5 or 10 minutes. What do you want to talk about?
Well, I need Doc. Just on our way out, let's just sit for 5 or 10 minutes. I'll even walk you out to the car if necessary. So we meet at the end of the day. And hey, Doc, there seems to be a disconnect here, which I'd really like us to fix because sometimes we're in disagreement on a treatment plan. And give me a few guidelines here and you'll
Well, I
make up something.
I went
Just
to dental school. I know what my patients need. I know what I want to recommend, and you can have your opinion. It's fine. But at the end of the day, it's my practice and it's my word.
absolutely, it's your license, Doc. But you know what would really help? Two things I would like to offer you if you're open to this. Number one, if we can sit down and exchange ideas at the end of a day or in a morning huddle and see where, with Mrs. Smith, I saw SRP and you saw Prophy. Can we go over that and do a little, what I would call a post-mortem on it or a post-evaluation on it? Humor is something I use all the time anyway. It breaks tension. And the other thing, Doc, I really need you to understand this. When you openly disagree and openly express opposition to what I, in my professional judgment, have determined for Mrs. Smith, that sends a message to me that I'm not competent or qualified. It sends a message to Mrs. Smith, quite frankly, that you have an unqualified person working with her. So may I suggest that if there is a disagreement, we take it out into the hallway for a quick conversation or save it for the end of the day and let's talk it out. Because the more I understand you, Doc, and the more you understand me, the better we work together, and the less of this stuff will happen. It'll run smoother.
Well, I guess after you saying that, I'm realizing you've worked here for a while, 6 months, and we haven't ever sat down and really calibrated on cases and what we would recommend. So I guess that's my fault. We should sit down and calibrate that.
I
Okay.
got it. There's no fault here. I learned a long time ago from this guy named Alan Stern, you're not perfect, get over it. And you know what, Doc? Neither am I, and I'm not perfect. So let's be two human beings here. Let's be two well-educated, well-intended, but never perfect human beings, just working it through. And you know what? That will keep me here longer. It'll keep you happy. And frankly, Monday morning is not going to suck for me. We can work together in harmony.
Okay, cool. Well, let's tomorrow morning, let's schedule a meeting for a calibration sesh.
Let's get that party started.
No, that was good.
It could go sideways,
Yeah,
couldn't it?
it could.
Well, God damn it, Stephanie, I've had enough. You get it straight. I'm the doctor. I know this patient for 30 years. You're here 6 freaking months. How dare you pretend to know that?
And then
Doc?
maybe it's time to go.
Yeah, Doc, if
Yeah.
you feel that way, I'm willing to grow. But if you're not willing to recognize that I'm professional educable, maybe you got the wrong person here. Maybe
Mhm.
we're just not a good fit.
That's such a good way of it's so like non-confrontational. It's just like,
What good? Look, Stephanie, we talked about something offline just before,
mhm,
that I had a very serious issue hit me in the face very hard yesterday. And what I've learned to do through therapy, through great mentors, and through working it through myself is I put a filter on my mouth. And I ask myself before I respond to something, what good will come of it if I say this?
mm,
And if the answer is, wow, this is going to be cool, yeah, I'm going to do it. But if I have doubt, if I think it's going to blow up a bad situation, I'm not saying it. And sometimes, Steph, the most important thing is the pause.
yeah.
Hey, Doc, I hear you. Let me have some time to process this and discuss it with you. And it could be 15 seconds, it could be 15 minutes, it could be 15 hours, it could be 15 days. I think what we do all too often is we knee-jerk respond
Yeah.
because our amygdala kicks in, the cortisol starts to flow, and wham, right in the face. And what happens? You get hit harder and you beat each other until one of us submits. What the? All right, you said shit. What the hell good does that do?
I know. And then the next day you're like, "Oh my God, why did I say all those things? Why did I just lost my job for a moment of
For
anger."
what? Yeah, I
Yeah.
mean, there is a time to fight. There is a time. If you're in a protected category and somebody makes sexual orientation or racial or ethnic slurs, I mean, that's intolerable. We're not talking about that here. We're talking about overly assertive, imperfect people who may not be comfortable in their own skin or who may be scared out of their minds, or maybe they're threatened. Maybe I'm practicing 42 years and I'm still thumbing in amalgams and using acrylic instead of composite. And here you are, the hygienist fresh out of school who knows oral systemic, airway, myotherapy, myofunctional
Yeah.
therapy. And maybe I feel threatened that this young person, I don't give a damn what gender you are, knows more than the great 42-year doc. If I haven't risen above and become enlightened, it's possible. But remember, anger is fear in disguise. If
Yeah.
you aim the beast, think about turning a roaring lion into a beautiful yellow Labrador. I mean,
That's what we have to remember, right? When we have those situations.
and Stephanie, it's really easy for us to stay here where we're not in the moment. And listeners, please understand that you're going to blow it every now and then. You're going to blow it every now and then, and you might have to punch a bully in the face, verbally, not
Yeah.
physically, please.
Yeah.
You might lash back, and it's okay. Forgive yourself because you're not perfect. But if we set as a goal to conquer this beast by trying to collaborate first with curiosity, can I use New Jersey language?
Yeah. I don't care.
What kind of bug do you have up here? You know what, Doc? Say that nicely, and if you convert 1 out of 10, you've done beautifully.
Well, let's do another one.
Please.
This is something I personally have experienced over the years. So I'm a dental hygienist, and the office manager, who is not a clinician, the office manager tells me that I have to do full mouth SRP an hour, and it's not in the best interest of the patient.
And what we're inclined to say is, are you effing kidding me?
Yeah.
Or how about on your license, not on mine?
Yeah.
And okay, so there's a few different ways to approach this. Mary, the manager, help me to understand what is so pressing. You're Mary, the manager now.
Oh, sorry.
You
I'm not
got
good with this role play stuff.
what? Bully me? Come on.
Okay, well, you're the hygiene department. You're behind on production. We have a goal this month and you need to hit it or else we're going to be in trouble. So you have to do this SRP in 1 hour.
I get it. Mary, what I'm hearing is that you're under a lot of pressure from your middle managers. Do I hear that correctly?
Yes.
Mary, we have to strike a balance here. And we have to create an agreement because Mrs. Perrio here has 9mm pockets across the board. Maybe in a situation of 4s and 5s, I might be able to do that for you. And I'll tell you what, I will give you my best effort. I'll guarantee you that. And I think we need to sit down with management and we need to figure out a way that we can create more production, more value to what we're doing, and maybe, God forbid, raise our fees in order to make this department more productive.
Can't you just do the full mouth SRP, do the best you can, and then touch it up next time when they come back in a few months and we'll just bill for the full mouth?
Let me ask you something really honestly, Mayor. I'm not trying to prove anything here, and I'm not trying to illustrate that I'm better than anybody. But if your mother was in the chair, what would you ask me to do?
I'd want you to treat her as if she was your mother and take care of her.
Exactly. And Mrs. Perrio back there is somebody's mother. She's somebody's wife. She's somebody's daughter. She's somebody's sister and friend. So I think we need to, if you are open to looking at this a little bit differently, I will open my mind and sit down with you and see how we could get our production up without compromising Mrs. Perrio's care. Because Mrs. Perrio is somebody's mother. And you know what? Mrs. Perrio is also trusting us. If we shortchange her as she goes to another office and that office sees some gingival black calculus, what's going to happen? Do you want to field that phone call or do you want to read that 1-star review? Because from my vantage point, Mary, I don't want the state board asking me questions and questioning my competency. But beyond that, it's really not about you or me. It's about Miss Perrio. And we really want to make her better.
So increasing production, I'm interested in that. And I wonder if we could maybe do some of that laser treatment that you've been nagging me about. Maybe we can start incorporating that. Is that kind of what you're talking about?
Yeah. I mean, look, if we are a PPO practice, those bastards are only going to pay so much. And we know very well that it's worth more. And I appreciate my salary. I really do. And I know my salary is not growing on that money tree outside of the office. And Doc's pockets aren't as deep as we think they are. Mm-hmm. I understand that. And the damn corporation's putting profits on the people anyway, and we're not going to tolerate that crap. I'm going to say that. But if we can add treatments to this, if we can add fluoride treatments, laser periotherapy, we got this. Why don't we strategize with the owner doc on how we can incorporate some of these things? I'm willing to take classes on biofunctional therapy. I'm willing to take classes with Doc on airway. And maybe it won't show in my production, but I'll be able to set these people up for better and better procedures. Please understand that my productivity, yes, you want to see a line by line productivity. You want me to generate 3 times my salary in a perfect world. But what happens if I generate 2.5 times my salary and I find Doc a big, fat, full mouth rehab to do?
So do you think if you had more time to talk about those like veneer cases that we would see more production?
100%, Mary Manager. 100%. Time could be our friend. I understand how you're thinking, and I know the pressure. But let's see if we could turn it around and treat every human being coming in here like they're your mother or mine.
All right. So it sounds like you're going to do what you can in the hour that you have. And then maybe we should set up a meeting with the owner doc and figure out how we can take hygiene to the next level.
Yeah. Mary, I can't thank you enough. Look what we did. we just turned what could have been a confrontational, everybody loses discussion into a win for all of us, including the owner. Thank you for listening, Mary.
Oh my gosh, Alan, I'm just like looking back at how I have handled this situation, and it was not anywhere close to what you just said. Like it
You're,
was a lot of this
yeah,
finger
but
pointing.
and look, sometimes it comes to that because Mary could be Mary McNasty.
Yeah.
Mary could be a real stubborn, ignorant person and Mary may be feeling way too much heat from the owners. Crack the whip.
I know. Yeah.
If these providers provide it. So let's just make this clear again. You are not going to get this right 100% of the time. This is something we need to aspire to. If you hit the jackpot once, you are awesome. If you hit it twice out of 10, wow. If you hit it 3 times, will you marry me? No, my wife's no.
Don't get in trouble, Alan.
For a living.
Well, I knew this conversation was coming up, and I've just been thinking about my career in clinical dentistry. And it's like, I don't know if I have been bullied per se, but I can tell you now that I'm in the social media space, I have 100% been bullied on social media. And so, do you have any advice for how to handle that? Like, I've seen docs post a picture of their crown that they're super proud of, like a picture of it in an x-ray, and then the comments, they get completely torn apart. So how do you recommend people handle that?
That is a very tragic situation. And I'm not hyperbolizing the word tragic. It really is, because our profession is fraught with depression. The end point of untreated depression, suicide.
Yep.
And it is so easy to sit here behind the comfort of in my chair and my desk with this little keyboard down here and type, "What a piece of garbage you are, you ignorant fool."
It's crazy.
Yeah. And there are a couple of things here. Number one, my good friend Paul Goodman is very good at moderating. I do a lot of work for the Dental Nachos team, and Paul is very good about muting people.
Yeah, he is.
Because the fact of the matter is there's more than one right answer, and nobody's work is going to be perfect, ever. I have friends who are high-level prosthodontists, the most sophisticated dentists in the world, and they're looking for answers, and they critique their own work. Number one, I think, listeners, we have a responsibility here to be professional and pull the person off. If, let's say you see a crown whose margin is just, wide open, like an open door, message the guy or girl or lady. Whoops, girl, can't use that word. No good. Message the person and say, "Hey, doc, can I have a word with you?" I've had those conversations offline, and I've been bullied out of hygiene sites. You know that?
Oh, I don't doubt it.
They jumped all over me. Holy I joined one of the hygiene communities, number one, to learn the hygienist perspective. Number two, to offer a viewpoint that maybe we could work together. Let's not fight. And I got bloodied. And I was thrown off the site.
Do you think it was solely because you're a dentist?
Yes.
Okay.
And my message, by the way, it's no secret, hygienists and dentists are at war right now.
Yeah. Yeah.
And that's going to destroy what's left of our profession if we don't get a handle on it. Because what's going to happen is hygienists will have openly hostile things to say about dentists. Hygiene practices will open up. It will split the profession. Even further, it will diminish comprehensive care, because when we're under one roof and collaborating, we're so much better off. And the patients are going to get confused. And who's going to laugh their way to the bank? Corporations.
Yep.
Because we're still pawns in the game. We are better together. And that means a lot of responsibility on doctors' parts, because doctors' misbehavior is clear and documented, and hygienists' misbehavior.
100%.
But it's a truth. It's documented. It's known. Why don't we lay it down and say, "Hey, look, we got to get it together before we blow each other apart. Let's recenter on our goals." And you know what, Stephanie? You as a hygienist may not align with my mission as a dentist in my practice. That doesn't mean we're no good. It means you're not a good match, and you find an office and I find a hygienist.
Yeah.
But getting back to online, I think the best thing you can do is say, that's too harsh. You go ahead and have your last word. As far as I'm concerned, this discussion is over.
Hmm.
That's all you can do. I think the worst thing you could do is try to fight fire with fire, because like the other examples, it just escalates into online ugly.
Oh, yeah. I just don't engage now. When anyone says anything mean or bullyish to me, I either block them or delete it or just flat out ignore it.
I was attacked, fortunately on private message, by another dentist who insisted that I disclose how much I make, how much money I make. I don't want to say, I don't even want to talk about the characteristics of the person. I don't want to give it. I don't want to openly tar and feather somebody. I'd like to punch him in the face, but I'm not going to do that.
Yeah.
But I present my best self. And I said, look, Dr. X, we clearly have a disagreement with me. Let me wish you well, and let's stay out of each other's lanes. And he responded, no, you don't wish me well. Are you kidding me? I wish every moron well. Stupid people have a right to be happy just like we do.
Yeah.
But, there comes a point where you can't win. But when you work with kindness to your imperfect best, you walk away from that with your head high.
Yeah.
You don't have any bruises on you. And eventually, those bullies, the karma will take care of it. There was one dentist who was openly just aggressive against a good friend of mine, constantly stirring things up. And that dentist is in a bad way right now. You live by the sword, you die by the sword. Let's rise above it. It is not easy, Stephanie. When you have a dentist berating you or telling you that your treatment plan is just plain stupid, you got to resent that.
Yeah.
But if you could just take a moment and pause, rise above it, and try to crush it with kindness first. And if it doesn't work, you could always go back and drag him into the street if you have to.
Right. Yeah. At least start and try to be kind and curious, right?
Figuratively, please. Not,
Yeah.
we don't encourage violence. I abhor it.
Yeah, definitely not recommended. So I have a lot of my followers are hygienists, and they would do like a working interview, and then they would notice right away that maybe the office is like quote unquote toxic. I feel like that word is being thrown around a lot these days, but do you
Yeah.
have any like warning signs or red flags that someone could look for when they are first starting at a practice that might give them pause?
Pause is the right word. I think just hanging out and talking to the team. I think if you're interviewing for a job, even before a working interview, and working interviews are a little controversial.
Mm-hmm.
I'm not sure that I want to hire somebody, say, hey, Stephanie, this is Nancy Newby here. She just got out of hygiene school. She's having a working interview. Would you mind if she takes care of you with these sharp instruments and these picks and these things? I'm not sure of that, but what I would do, and that's controversial. That's my opinion. There's more than one right answer here. But I would shadow the office for a day or two before taking the working interview and watch the hygienists, watch the team's interaction with each other and with the patients. Learn the patients, learn how the doc communicates with people, and learn if you have something to give here.
I always looked for gossiping between team members. And if there was a lot of gossip, I was pretty much like, it was a hard no for me.
My office was very small, Stephanie. It was just 4 of us.
Oh, wow.
Self, an assistant, the hygienist, and the front desk person that I slept with. And we had a rule. And by the way, there's a stigma on doctors' wives in the office.
Yes, there is.
And I'm very proud of the way Fran handled things in our 36 years in the office together.
So just to be clear, the front desk person that you just mentioned you were with is your wife.
I'll leave it to your imagination. Yes.
Okay.
48 years next week, Stephanie.
Oh, wow. Congrats.
5 of the best years of her life were spent with me. But I think we had a rule in our office, and it applied. Well, there wasn't much yakking about one another, but you could apply this rule to the team as well as to patients. We don't say anything about anyone that we wouldn't say to their face.
Yep.
Now, there's a challenge there because Miss Vicious is coming in and she's a pain in the ass. And you really want to say that. And you may say it back here, but try and filter it and say, Mrs. Vicious, she's not the nicest person in the world. She doesn't understand. She just doesn't get it. And maybe it's time for us to ask her to find somebody else. And if we just tone it down, it makes such a big difference. You're saying the same thing, but you're being kind and gentle and as loving as humanly possible for a nasty person.
Yeah.
Why not? And that's a discipline. It's hard. It's hard. If you want the easy way is say, I'll get her the F out of here. She's a pain in the ass. I don't even want to see her. Just throw her out when she comes in.
Yeah.
That's easy. But what good's going to come of it?
Well, I think that pause too, that's such a powerful tool just really in life, but it takes you have to be aware of your own thought patterns and realize when you're about to pop off or you're about to
Yeah.
be reactive and just shut it for a minute or a day or whatever. And you get a lot of wisdom that way.
There's a lot of mindfulness techniques that teach that. For me, I know that my heart goes somewhere between my chest and my chin when I'm stressed. And I feel this feeling going down my chest. And I know what that is.
Yeah.
That's the cortisol rush. So if you can cut that off before the cortisol level rises to a point where it's out of control, you got it. Can you do it all the time? No, you're not God. You're not Superman, Superwoman. But if you can do it, if you could start out small and then begin to increase its presence in your life, damn, you're on your way.
Yeah. God, you've shared so much helpful tips. Thank you so much, Alan, for all of your advice today. If somebody wants to reach out to you or connect with you, what's the best place for that?
You could find me. My email address is Alan, ALAN, at betterricherstronger.com.
Okay.
My Facebook group is Better, Richer, Stronger. Hygienists, I warmly and humbly and with an open heart welcome you, and we'll share perspectives, and I'll have a virtual coffee with any one of you. If I could be of help, that is what I'm here for. I would love a privilege, Stephanie, and thank you for having me.
Of course. Yeah. I'll make sure to put all of your contact information down in the show notes so it's easy for people. Thank you, Alan, again. And thank you, everyone, for listening. We will see you next time.
Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you, and by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.